Now when we look at your x-rays from the front to the back, the spine should be perfectly straight. So let's go ahead and look at an x-ray now. As you'll notice in this picture, this spine has a pretty good bend in it. Now this is going to indicate where the muscles are out of balance, the discs are getting pinched, the nerves are getting pinched. This patient has a high level of low back pain. So when we look at your x-ray, we're going to see if this is going on. It may be the cause of your low back pain. Now we're at the wobble station. The wobbles chair station is fantastic to help get rid of low back pain, disc problems, and sciatica. The patient here you're going to see demonstrating is moving side to side. This is creating a complete range of motion in the lumbar discs. This does a few things. Number one, it stretches all the muscles and ligaments that are tight. Number two is it creates a pumping motion that will pump liquid back into the disc, which over time will help to rehydrate the disc in those conditions. We'll also see the patient going forward and backwards. In this position, she's arching the low back, extending her back, and then she's flexing to stretch this way. This flexing and extending motion is going to create a complete range of motion in the forward and back angle. This will also pump the discs, stretch the ligaments and muscles, and help to get rid of the back pain. Normally here in the office we'll be doing these exercises from 3 to 4 minutes in a mild condition, all the way up to 10 to 15 minutes for very serious low back problems. Over time, as the discs regenerate and the discs pump up, the nerves will get less pinched, you'll have less symptoms of back pain, sciatica, and other radiation into the legs. A lot of our patients will call this the belly dancing chair because as they move into a circle, it really strengthens the core, the trunk muscles, and creates a lot better range of motion and flexibility here in the low back. Now we're continuing our low back treatment with the link trainer. You're going to notice our patient here, she has her feet placed against these pads at the bottom of this bar. She's going to be holding the bar with her hands, maintaining good upright position, and next she's going to push with her left leg against the bar. Now you'll notice that there's not much motion here. This is called an isometric exercise. She's going to hold this exercise for 5 seconds and relax. Then repeat. An isometric exercise is going to work postural muscles. These are the ones we need to strengthen in order to improve your posture. Isometric means nothing's moving. When you work out at the gym, you're using phasic muscles, which move your body. Postural muscles do not move your body, they just hold your body upright. So when we exercise these muscles, we're going to be holding the contraction for 5 to 10 seconds so that the postural muscles will get stronger over time. This exercise is fantastic to help strengthen the hamstrings, the glute muscles, and the lower back muscles, which are all generally weak in people with back pain, sciatica, and disc problems. Move to the second bar, please. So you'll notice that the patient extends her leg back, now lift the bar and push against it. So now we're in a slightly different position. It's going to work a little bit of different muscle groups, and it's going to continue to strengthen the posture in the low back, gluteus muscles, and the hamstrings. We're continuing our back pain treatment with the power core. The power core is designed to do 3 things. Number 1, it's going to increase the flexibility and range of motion of the lumbar spine. Number 2 is it's going to bring that normal postural curve back. And number 3 is it's going to strengthen the abdominal midsection. You'll notice that the patient is extending herself over the power core. She flexes her chin to her chest, and then she's going to sit up into a flat position. This exercise is actually very, very good for people with severe back pain. It feels very good to stretch those low back muscles in this position. And with the back supported, there's no chance for injury or making your situation worse. So it's very good. It's one of the first things we do when people come in with severe pain. So you'll notice Anna here is doing the extension. She's tucking her chin to her chest, and then she's sitting up. Now as the patient gets stronger, we can add some resistance. So we may just offer some resistance against the shoulders as she sits up. Makes it a lot harder. Those stomach muscles are going to get much stronger, much faster with a little bit of resistance. The power cushion is very good to help get rid of low back pain, disc problems, and again, sciatica.